Hi everyone, I had case study 58, which discusses hypoparathyroid disease. Alex White is a 52-year-old white female who was visiting her primary health care provider complaining of recurrent painful muscle spasms in her hands and feet, as well as dry, puffy skin. She states that she has not been herself for the past 5 weeks, and she feels irritable, aggressive, and has had combative behavior in which she has had several arguments with her family and friends. The patient also mentioned that she does not eat very much because she is rarely hungry. The patient's medical history includes 20 years of systemic lupus erythematosus. She's had multiple malignant melanomas on her arms and face in which she has had them surgically removed. She's been hospitalized in the psychiatric unit on 2 occasions for attempted suicide and 4 years ago for a leaking cerebral aneurysm. She had her tubes tied after the birth of her son 29 years ago. And she has a chronic history of alcohol abuse in which she has been admitted to alcohol detoxification 1 time. She smokes approximately 1.5 packs of cigarettes a day and has for 34 years. And she also has a personal history of sexual and physical abuse. Amber's family medical history is quite severe. Her father died of pancreatic cancer and her mother died of heart failure. She has a sister with bipolar disorder and suicidal tendencies, a brother who died of a heart attack, and 2 other brothers that died of lung cancer. There is a major family history of alcohol abuse as well. The patient is currently not taking any major medications except for the occasional over-the-counter meds for heartburn and the occasional NSAID for flare-ups caused by her lupus. She has no known allergies, but overexposure to sunlight causes a rash on exposed skin, which is also related to her lupus as well. The patient denies any form of thyroid or any type of neck surgery, and all of her exams, including her cardiovascular, respiratory, gastrointestinal, urinary, musculoskeletal, lymph nodes, and ears, nose, throat exams all have normal findings. Except for the occasional headaches and dizziness, the patient's neurological exam is normal too. The patient's skin is pale and dry with flakiness but has no other abnormal findings. Overall, the patient feels fatigued and weak and has a poor appetite. Amber appears thin, frail, and undernourished, but is in no apparent distress and is in good spirits. She is alert, attentive, and cooperative. The patient's vital signs reveal that she has an extremely low BMI for her height of 5'5" and weight of 97 pounds. Her heart rate, respiratory rate, and temperature are all normal, but her blood pressure is slightly increased at 130/85. Amber's laboratory blood test results show that everything is in with normal ranges except for her sodium, potassium, calcium, hemoglobin, hematocrit, magnesium, parathyroid hormone, and vitamin B12 levels are low. Her GGT levels and AST levels are high. In conclusion, the patient appears to be suffering from hypoparathyroidism or hypoparathyroid disease.